CAMH Government Partners, welcome. You're being asked to take on a challenging project to transform an important government health program. You will need a set of trusted partners to help you. Your agency staff knows it needs some help to solve a problem. But your project is far from the routine types of work you can specify in an RFP for performance by regular contractors using commercial products and services. Your project is very complex, and there may be little or no precedence for your proposed task, depending on the capabilities required and your program's needs. You need a different kind of help. It's time to explore one of the best-kept secrets at HHS, the CMS Alliance to Modernize Healthcare, also known as CAMH. CAMH is a federally funded research and development center, or FFRDC, sponsored by CMS and HHS, that may differ in some significant ways from any other entities you've worked with in the past. FFRDC difference. Unlike commercial contractors, CAMH was created by CMS to help all HHS operating divisions and offices tackle complex, transformational changes to achieve their core missions. This video was created to help you hit the ground running with CAMH to help accelerate your new project. CMS designed a health-focused FFRDC to help health officials address new challenges, such as creating new health programs and new information flows during times of change and transformation. CAMH was chartered as an alliance, allowing CMS to pull in the best capabilities from industry and academia. CMS sought approval from its oversight committees on Capitol Hill and OMB before establishing CAMH. In 2012, CMS selected MITRE as the operator of CAMH. As an FFRDC, CAMH plays a special role defined in the Federal Acquisition Regulation, the FAR. Under the FAR, FFRDC personnel take extraordinary measures to avoid conflicts of interest and in return are afforded access to sensitive and proprietary information that the government cannot share with other organizations, including contractors. As a result, experts from CAMH can sit on the same side of the table as government personnel as trusted advisors. Capabilities. Specifically, CMS created CAMH to provide CMS and other HHS staff the operating divisions access to unbiased advice and assistance related to policy, business, operations, and technology. The best available health experts in the private sector, academia, and nonprofits. Neutral strategic and tactical studies, analysis and proofs of concept about policy implications, potential operating models, and technology solutions. An R&D program that develops new technologies and innovative uses for existing technologies to solve most critical problems, and to get all of these from our CAMH operator, a trusted partner that is free from conflict of interest with deep expertise in a wide range of healthcare, health insurance, population health, and biomedical technology topics. By leveraging the CAMH FFRDC, you will accelerate progress in modernizing healthcare. CAMH's independence means it can help you assess federal program design options, draft regulatory rules, broker partnerships with industry, and evaluate alternative products and services, among other things. Past missions. In one example, CMS tasked CAMH to help stand up in the Quality Payment Program to implement the Medicare Access and Chip Reauthorization Act of 2015. CAMH, working in partnership with a university partner, developed the performance scoring system for the new merit-based incentive payment system, including modeling the scoring and the impact of the scoring. These analyses will inform how clinicians will be paid under Medicare Part B, based on value over volume. In a second example, CMS engaged CAMH to accelerate momentum toward value-based payment structures that reward the delivery of high-quality, low-cost healthcare and improved population health. CAMH facilitated gatherings of stakeholders and analyzed options to accelerate the design, clearance, and implementation of new payment models. Over the long term, these efforts enhance the government's efforts to drive improvements and reforms across the nearly $3 trillion healthcare industry. In a third example, the Centers for Disease Control and Prevention engaged CAMH to develop a new, secure, cloud-based integrated surveillance data platform to reduce the reporting burden on external stakeholders and improve the efficiency and agility of surveillance programs nationwide. The project affects over 100 surveillance systems that CDC operates to detect and monitor disease outbreaks, assess the impact of interventions, and assist in expediting recovery from large-scale public health incidents. Getting started. This video was created to help you hit the ground running with CAMH to help accelerate your new project. We know that you may have multiple projects to juggle, each with tight deadlines, so you are pressed for time. This video focuses on the most important things you should know to help you get the healthcare modernization expertise you need, to get the outcomes you need, in a fast-paced and rapidly changing environment. Because of the strategic nature of CAMH projects and CAMH's access to privileged information allowed under the FAR, the process for ordering from CAMH is unique. The ordering process is defined in the CAMH Ordering Guide, available from the CAMH PMO. This document is updated regularly, so make sure you have the current version. If you are thinking about using CAMH, please contact your contracting officer or the program manager of the FFRDC, or email camhffrdc@cms.hhs.gov. MITRE, the CAMH FFRDC operator, can help you to shape the tasking needed to achieve your desired outcomes. Chances are you already understand the roles of government technical leads, contracting officers representatives, and contract specialists for ordinary contractor task orders. Those roles are essentially the same with tasks for CAMH, with a few key differences. Mainly, that MITRE can assist you with many steps of the process. Prospective GTLs are encouraged to work with MITRE and with the CO or COR to shape tasks that meet a special three-part test to demonstrate that the work requires the special characteristics of an FFRDC and CAMH in particular. The three-part test assures that: first, that the work falls within the purpose and scope defined in the FFRDC sponsoring agreement. Second, the work requires the special FFRDC relationship, which assures trust based on objectivity, freedom from conflicts of interest, and permits access to sensitive government and proprietary information. Third, the work is closely aligned with the strategic objectives of the sponsor. MITRE can help you scope the work and provide rough order of magnitude estimates even before you develop your own independent government cost estimate. CMS selected MITRE as the operator following an open competition, so the CAMH task orders are not competitive selections and are encouraged because typically FFRDC tasks are less well defined at the outset than tasks for traditional contractors. Shaping the work with MITRE and the CAMH PMO generally helps you get the project launched faster and ensures compliance with the FAR rules that govern CAMH. MITRE and the CAMH PMO can also advise you when a task is not FFRDC appropriate and should be directed to commercial sources. A second key difference from traditional contracts is that CMS has a unique governance process for overseeing CAMH. When you propose a task for CAMH, the PMO reviews a Contract Use Request Form, or CURF, to validate the work that is FFRDC appropriate. Larger tasks for CMS above a specific dollar threshold require the approval of the CMS CAMH Executive Steering Committee, a group of CMS senior executives who govern the FFRDC. Non-CMS task orders are approved by the Executive Steering Committee Chair only. In addition, to help ensure your project achieves your desired outcomes and meets the three-part test for appropriateness to the FFRDC, CAMH has well-defined steps during the execution of the project lifecycle to define and track your project's performance measures, summarize the value your project is generating, solicit your feedback through quality surveys, and publish an annual review of all CAMH work. By leveraging the CAMH FFRDC, you will accelerate progress in modernizing healthcare. Welcome to CAMH, your FFRDC.